Okay, so my patient is recovering really good, and the physician came around and said that he doesn't need any more of the antibiotics, so we have to discontinue the IV fluids. Okay, so the first thing I'll do is check the physician's orders, and then I would ID the patient, make sure that it's a correct patient, check his ID band. I would tell the patient what I'm going to do. I'll shut off my machine. I would take off the tape. Okay, so all right. So I got the tape off, and now I'm just going to unscrew the IV. So I'll just anchor it right there and just unscrew. So it's all done and it's taken off. Okay, but then he's just left with this little clave, and I think we should be putting an extension tubing on that. But I would, before I put the extension tubing, I would note the time that I took off the IV. I'd get my extension tubing pack. I would open it. All right, and I would proceed to get my flush and prime it. Okay, so here we go. Get my flush, open it, take out the air from it. Good. And I'll get my extension, attach it, screw it on nicely, and then I would flush and make sure it's going through and it's priming good, nicely. I would loosen the cap and I'll place it back in here. Perfect. Okay, now after I do that, I would loosen my clave here. So I would just kind of loosen it a little bit. Great. I'm going to put on my gloves because there's a chance of getting contaminated here with blood. So I'll put my gloves on. Okay. Okay, there's my gloves. And I would get my 2x2. And my 2x2 I would open with sterile technique. Alright, good. I would take that and I would place it just right underneath here and make a little sterile field. Right here. Okay. Okay. Now I am going to put some pressure at the end of my IV site here, the cannula right here, and I'm going to stabilize the vein and while I take the clave out. So I'm going to do that, stabilize and unscrew. Oops. Okay. So I got it out, and now I am now going to attach my extension tubing. It's all done here, right? So I take the cover out and I go like this and I just screw it on. Right, then I get my, I aspirate, make sure there's blood coming back, that means it's in the vein, I see blood, and then I just flush. I would just flush my 2 mils of saline, checking for patency, infiltration, resistance, any kind of phlebitis, that type of thing, and when I'm done, I would remove my saline and secure my IV site with some tape. Alright, that's what I would do, and I would remove this. I'm done with that. And then I would just chart. I would chart that I have discontinued my IV. I would chart that I put the new extension tubing, and I would chart also the condition of the site. And that is what I would do at that point.